share this link with someone. If you need to also be able to connect right now, please do that. So we're able to get the good information we're about to give you. And guess what? We're doing life experiences of people that have gone through fertility journey, that have had bitter experiences, but at the end of the day, they had sweet endings. So you never know who this might be helping right now. Call up someone who might be struggling with fertility issues, struggling with conception, someone that maybe had multiple IVF failures. You just someone, you just don't know who you might need this, but just share this link whichever way you can. So people are able to get so much encouragement to move on and know that there's hope out there. It's not over until it's over. And today we have IVF house of Arts Hospitals. We have Dr. Deborah Ruby. Yeah, I call her the IVF house of Arts Hospitals because she's the IVF coordinator. She's first with family physician. She's a fertility specialist. She's also the IVF coordinator of Almighty House. Yeah. Oh yeah,
Thank you for having me. Always a pleasure to be here. Thank you.
Then it's good to have you with us today. Dear viewers, I know you're also excited to have Dr. Deborah. So she'll give us some little insights into the testimony of this person that has come to share a life experience with us. Some people are able to pick one or two notes and pick lessons that could actually be of benefit to them, while Dr. Deborah tries to elaborate on some of the points that we did fit for our dear viewers to note. Okay, so considering that donation, so okay, this person assessed the care of IVF using egg donation. For some strange reasons, we couldn't do this last week. So we'll have to repeat this for someone watching for the first time. So it's good that you all take your notes down, jot your thoughts, your questions, your opinions in the comment section, and we'll definitely attend to them appropriately. Okay, so this says considering egg donation as a method of building your family, wondering how the process actually works. Today's episode will be sharing IVF story of one of our clients with her husband who chose to pursue IVF process using egg donation, the challenges they had encountered, and how IVF egg donation helps them become parents now. So this is the woman speaking. And so for the sake of those people that might be discriminating, we would rather keep the identity of this person confidential. So we just read out her story while we keep her information confidential just for um, convenience sake. So she says, when it came to thinking about our future, we both knew we wanted children. My husband and I, that's her speaking, her husband and herself came from very loving and supportive family. So they were hoping that they could also breed their own to be something like that, which made them want to have their own. What they didn't anticipate was how hard it would be to become parents. You know, it gets me wondering, Dr. Deborah.
Yeah.
You know, I think this fertility thing, people really we don't see it coming. Is it a genetic thing? Because maybe I know there are some families that might have issues with conception. Is a family thing,
Yeah.
or
Yeah.
are there possible things for people to experience this whole infertility thing in the course of the
They're
journey to
trying
parenting?
to,
Yeah. So,
yeah.
what are possible things that could result to this infertility for couples
Yeah.
trying to
So
conceive?
okay, so infertility can be caused by a lot of factors. Some factors related to the woman,
Okay.
some related to the man. So we
Okay.
have the female factors that could be contributing to infertility, and then the male factors. So,
Okay.
like you said, there are some causes that are genetic.
Mm.
Because, for example, a condition like polycystic ovary syndrome has some genetic components, so it
Oh
could run in
wow.
families. Yes,
Mm.
so components could be genetic. Some could even be things that happened while the person was being conceived. things that happen in the womb, in utero, even before the person was born, things we call
Wow.
congenital anomalies, especially
Wow.
congenital anomalies involving the reproductive tract, like the uterus, fallopian tube. You could have absent fallopian tube. You could have anomalies, abnormalities of the uterus that do not support a pregnancy being there, like septate uterus, aqueous uterus, and so on. So, a whole barrage of reasons could be responsible.
Okay.
Some could be due to iatrogenic causes. Maybe what you say iatrogenic, things caused by maybe a surgical procedure that was done. A
Oh,
woman
okay.
that had ectopic pregnancy, unfortunately, and her tubes are removed. She
Hmm.
doesn't have fallopian tubes anymore. So
Yeah.
spontaneous pregnancy cannot happen in that situation. So she
Okay.
would need assisted, fertility care. So
Hmm.
a lot of reasons. Male factors, things like azoospermia. Some men do not have sperm cells at all
Hmm.
due to either congenital problems from the womb, or even issues with maybe infections they had as children. Like,
Wow.
yes, could
Hmm.
damage the testis, that the testis is not producing any sperm cells any longer. Things like
Hmm.
mumps, even severe
Hmm.
malaria, exposure to radiation. So this issue of putting your laptops or phones very near your groin, the scrotum, and so on, all those could lead
Wow.
to damages to the testis that could affect the sperm, leading to
Hmm.
even low sperm count.
Wow.
Yes, that
Hmm.
could lead to problems with fertility and so on. So a lot of reasons, a lot of reasons. I don't know if we should go into
Okay.
more. A lot of
Okay.
reasons.
Okay.
Yes.
So dear viewers, she said something that really caught my attention. She talked about infections in children. Sometimes a lot of parents do self-medication, and you might not even know what
Yes.
you're treating. Once there's
Yes.
temperature spike, you just say malaria don't come. The next thing you're treating malaria without investigating to know what the exact cause
Issues.
is.
Yeah.
And then we don't know what if we this is more like saying we are playing with the future of our children, because we
Yes.
don't even know what I'm sure some people that actually have these issues now, if their parents knew better,
Better.
maybe
Yes.
just maybe they could have been savaged from this
Yes. Even
whole
some.
mess that they
Sorry to
find
interject. Some
themselves.
children that are born, and the testis
Hmm.
is not in the scrotum,
Hmm.
and the testis needs to be in the scrotum, because
Okay.
the temperature around that area is lower than the
Yeah.
body. If the
Hmm.
testis is still in the abdomen, some children are born with that,
Oh
the
wow.
undescended testis. That
Okay.
if it's not corrected surgically in time, it could
Hmm.
lead to damage to the
Oh
testis.
no. Wow.
So that has
Wow.
already affected the reproductive, future of that child.
So, we say children are the leaders of tomorrow. So, if you have a parent watching right now, please take the health of your children very seriously and do not do self medication. Seek proper attention,
Medical
and not just
attention.
from anyhow hospital, from a good and standard hospital, so they're able to give your child the best of cares to prevent some of these issues that just could have been savaged from when they
Yeah,
are kids. And then,
exactly.
speaking of PCO, yeah, before the live chat, I actually was reading a post online. Someone talked about PCOS. Well, she's lucky she has a kid now, but she had to struggle with
Yeah,
conception when she got married.
yeah.
And as a matter of fact, when she was single, she used to be excited that she does not see her
It's
period
period. Don't know
because she
that.
has painful
This
menses.
is
And she was like, by the time she was not trying to
you
conceive,
conceive. That's
and they
it.
now did some tests in the NHS in the UK, and they were telling her that she had
That's
symptoms
polycystic
characteristic
ovary
of, and
syndrome.
then she had a transvaginal scan. According to her, she had PCO, and she was like, oh, so all the periods she was not
That
seeing,
was
that she was
happy. She didn't know there
jubilating.
was
She
something on the
exactly.
ground, sinister
So
on the
her
ground.
point that what she was
Yeah.
trying to say was early detection
Very,
sometimes
very
could savage
important.
all
Very,
this.
very
So as a
important.
young person you're watching, yeah, you might say I'm not ready to conceive now, but you could do something that could actually salvage your future, that could
Yeah.
prevent some of these issues that people have to deal with now. Well, this is just a little peek from what Dr. Debbie has said with regards to things that could cause fertility. Because, like this client, she was saying that she never imagined that
She would
she would
have
have
to
to
wait.
battle for fertility.
Exactly.
People really don't envisage this, but it happens.
It happens.
It happens to
Yes.
the good, it
The
happens to the
bad,
bad.
it happens to the
So
ugly.
exactly. So
Yeah.
it doesn't look, they say they look face.
Yeah, exactly. It
so
doesn't.
so please.
Sometimes it doesn't even follow lifestyle, because
Yeah.
there's some causes of infertility that we say unexplained infertility. So you've done
Mm,
all the tests and everything, and you can't really
yeah.
pinpoint what the
Well,
cause is. Yes, so
mm.
that is also there.
Well, so you see, dear viewers, there's just a lot. So that's why you can't afford to say this lesson today is not for you, because there's just a lot that you have to grab from this lesson. So if you've not called up someone, please do that right now.
So they're able to get so much insight from what you're getting. So back to our life experience.
Yeah.
So she said, what we didn't anticipate was how hard it would become, it would be to become parents. In 2019, after trying to conceive for a year on their own, they sought medical help from a fertility clinic. And then they began fertility treatment right away. And that reminds me, so how long should the couple try before they seek fertility help? Because they seem to
Okay,
have
so I
tried
think
early
the,
enough.
the important factor is the age of the woman.
Okay.
Yes, so if the woman is less than 30, they can try for a year before
Okay.
seeking fertility help. But once she's more than 30, after trying for about 6 months, please seek help. Yes.
And then if you know you have problem from when you get married, don't wait. Just seek
Especially
help.
yeah.
When you know not, maybe they've
It's never
told you
too
that,
early.
yeah, you
Yes.
know, if you know some underlying issues from before you got married,
Exactly.
why just
Yes.
stay and while away
Exactly.
time
Maybe
that you're
before you got married,
trying?
you were told you have huge
And
uterine
probably,
fibroids, and you have an inkling that that could be contributed. You don't have to wait for 6 months
I
or wait for a
mean,
year
exactly.
before
So when you
seeking
know some
help.
of these
Yes.
issues that could be addressed, you don't
Yes.
have to wait for
Like
so
someone
long
that was
once you've
diagnosed with
identified.
PCO as a spinster, you
Mm,
were not trying to conceive then, so it
mm,
wasn't
mm.
an issue. But
Yeah.
knowing that, and then you are now married, you shouldn't have to wait
Wait
before
for
you
so
seek help.
long. Yeah.
Yes.
So hope that hits you right at the spot that I wanted to hit you. Okay, so back to our story. That not really not a story now because we're talking about a life experience, but it sounds like a story to people that are watching because you I'm telling you the story of this person. So we began fertility treatment right away, undergoing 5 cycles of IUI. So, Dr. Deborah, IUI, what's IUI? 5 cycles.
Yeah,
Ooh,
so
wow.
IUI is a form of fertility care too.
Hmm.
So it's what that means is intrauterine insemination.
Okay.
Yes,
Oh,
so what
wow.
that means is that the woman is stimulated, she's giving drugs to encourage her ovaries to produce eggs.
Okay.
Yes, and then instead of meeting with her husband, the sperm from her husband or
Okay.
partner is collected, and then
Hmm.
this is directly inseminated into her at
Oh,
about the time that
wow.
ovulation would
Would
occur
happen.
in the
Okay.
theater. Yes,
Oh,
so that's
wow.
what IUI
So
is
they tried five
because
cycles.
of that.
Wow.
Yes,
Wow. So who do you likely recommend IVI for? Because for this person to have done 1, 2, 5, that's a lot.
that's a
Who would
lot.
you
Yes.
recommend that? Or is it everybody you just say IVF is the way, or there are people you would recommend IUI
No, no,
for?
definitely. Yeah,
Okay.
not everybody would need an IVI straight on.
Okay.
Yes, so
Mm.
that's why evaluation is important. So
Mm.
when you evaluate for a young woman that's ovulating, you've done her hormonal assessment and everything.
Yeah.
Everything seems fine.
Mm.
It seems she's producing eggs. For you to do IUI, you must have patent tubes.
Mm.
Yes.
Oh,
So for anyone with
wow.
blocked
Okay.
fallopian tubes, you can't have an IUI.
Mm. Okay.
Yes.
Okay.
So for someone that has patent fallopian tubes still in producing eggs,
Yeah.
she can have an IUI. Yes,
Okay.
but for
Okay.
postmenopausal women, people with blocked fallopian tubes, you can't recommend an IUI.
Alright. Okay. So
Yes.
hope you also noted that and
And
don't
then the
just
sperm must also be good.
mm,
Yes, low sperm count, and IUI might not work for low
low
sperm
sperm
count because we
count
need the sperm count to be of a certain level.
level. So you don't just go and meet your doctor and say, okay, I want to have an
Like
IUI.
IUI,
At least
yes,
allow them assess you and know if you're good
exactly.
enough to have an IUI. And then she said they had 3 cycles of
I
IVF. So meaning I think they had five
cycles
cycles
of
of
IUI
IUI,
before
three
stepping.
cycles of IVF. Wow. And they still didn't achieve
That's,
pregnancy.
that's
Wow, this is a
that's quite
lot.
a journey, yeah.
Yeah, I can
Quite a
imagine.
journey. Can imagine the cycles of failure, the emotional
Yeah.
trauma,
Wow. Wow.
psychological, a lot. They really
Wow.
went through a lot.
Oh, I
Yeah.
can imagine.
Mm.
Honestly, for someone that might have actually gone through this, or even more than what this woman had to go through
Yeah.
before she got her dream come true baby, I really sympathize with you, and we really hope that your dreams come true very soon, sooner than you envisage or
Mm.
sooner than you expect. Really hope that you get your dream baby or dream baby soon. So on, she said they had had this until she was eventually diagnosed with unexplained infertility.
Infertility.
So there are times that you don't have an explanation
You
as to why
can't, yeah,
someone is
exactly.
not
You do all the
conceiving.
tests and you can't really
Wow,
see anything abnormal. But
wow,
this woman is still not getting pregnant.
getting pregnant.
Everything
Wow.
seems to be fine, but she's still not
Hmm.
getting pregnant.
So she said it was at this point a family friend recommended us to Alps team.
Okay.
And we are glad we transitioned to Alps Hospital for this part of our journey. Wow. Thumbs up to Alps
Yes.
Hospitals. Oh, yeah. So, dear viewers, at this point, I want to see your like buttons popping up Because yeah,
Don't
this
see
is
your
someone giving.
thumbs ups,
Oh yeah, so
emojis, and
yes,
love
let's see.
emojis.
Oh yeah. So yeah, you might just be clicking and then the miracle is hitting you. Like they'll say, type amen if you want to get this answer. Okay. So we found it to be a better fit for us overall. So they are just talking a little about Alps Hospital for someone watching for the first time. Alps was always very communicative, supportive, informative of every step of the way. Speaking of communication and supportive, how do you manage to communicate with your clients every step of the way, keep in touch, and not have to have clumsy informations and all? How do you deal with this and your clients?
Yeah, so it's not easy, but we're able to manage it. So
Mm,
you just communicate to them in clear terms, simple English they can
mm,
understand, and we usually follow up with phone calls. We have different people calling. We especially that visit where they come for evaluation. You try to explain as much as you can at that time. We also have leaflets, the information
mm,
written out that we give to them that they can take home, to look at. So we
mm.
just keep communicating. We encourage them to be open, feel free, ask all the questions they need to ask, any
Yeah.
area they're not clear about.
Mm.
And we don't pressure them. We allow people go at their pace. When they're
Mm.
comfortable,
Wow.
for any procedure or process, their consent is sought. So they're
Okay.
not coerced,
Oh
they're
wow,
carried
that's
along.
nice.
Yes. So that's
Mm.
how we manage the
Also, I also wanted to ask because sometimes when people say I'm coming for a fertility treatment, maybe they think you see that people just they'll be in the hospital all through that journey, or
no.
you put allow them they can still do their normal activity, they can still
Yes, they
work,
still live their
do
normal
everything.
lives.
Oh
Yes.
wow,
Even
okay,
for our clients that come from out of state, we try to make the process as seamless and as stress-free
mm.
as possible.
Okay,
So a lot of, part of the treatment will be done at where you are domiciled. You
mm.
don't have to be in the hospital or be in our, perimeter throughout the duration of the treatment, depending on
Wow,
the kind
that's
of
so
treatment.
flexible.
Yes, and we
Mm.
explain how the treatment is likely to go so that they can plan ahead, schedule their programs and so on.
Okay.
Yes.
Okay, okay. So before we take this question, maybe we'll just try as much as possible to see how we could finish the
Okay.
life
The
experience of this
testimony.
person. Yeah.
Yeah.
So, she said, with the support of ALP's team, we began to come to terms with the fact that traditional fertility treatment pathway might not be enough to help us conceive.
Yeah.
After so many unsuccessful fertility interventions, it was clear that we could potentially continue to struggle if they continue the way they've been.
Yeah,
And so
that's true.
now, she has gotten to the point where they've given her all options available. So she said, the ALPS team helped us understand our potential options. So I think more like you gave her different options and then she
Yes.
would decide what form
They
of
would
treatment she
decide.
wants to go for.
Yes.
So it's continuing with IVF treatments where her eggs. Okay, so from what I can understand from what she's saying, it seemed like from the IVF she has done, once you get to day 3, the growth of the embryos are
Gets arrested.
arrested with using her own eggs.
Okay.
So with this history, they gave her the option of if she still wants to go with her eggs or if she wants to just go with donor eggs straight up.
Okay.
And from what she said we chose to shift our perspective and took a leap of faith, moving ahead with the donor conception process. So obviously, she had the option of using either her eggs
Oh, don't
and
know.
likely still encounter what she
The counter
encountered,
before.
or take a further leap and go
Try
for
something
donor.
different
Yeah,
using
try
donor eggs.
something different. Yeah, exactly. And then that was what they opted for. So speaking of donor eggs, I know we have a lot of contention with this donor egg. People are really struggling to come to
Yeah,
terms with.
people
Yeah,
are.
so I mean, when I just remembered someone that told me that she was going to use that she wanted to opt for IVF treatment using donor sperm. And then I think whether she was asking because my friend seemed to be a fertility, I mean this UPU's field, and
Okay.
she was asking her that where are they going to get the sperm from? Is
From.
it from an animal?
Oh
So
my God.
and I was
How is
like,
an animal
oh
sperm
wow,
compatible with human life?
hello,
That
so
can't
maybe
work.
you could tell us a little, like where do you get the donor eggs from? Is
Okay,
it from
so
animal
so
as
so
well?
it's just the way we have donor blood banks. We have blood
Okay.
banks for people that
Yeah.
want to donate. So we have agencies
Okay.
that are into egg donation, sperm donation.
So the egg is collected from a human being. So it's
Yeah, it's
still
collected by from
mm.
a human being.
That's the
Definitely,
point I'm trying
we
to
make, yes, it's
establish.
from a human being. Yes.
Okay, so for someone watching, wondering where the
Which animal?
so
Okay.
for someone wondering
The
where
way
these
some
eggs are
people
gotten
think,
from,
that's
so
really
obviously
wild.
it's still the same egg that they would have gotten from either the woman, if it's your partner, they'll just get
Yes.
it from another lady that seemed to
Yes, that
be
was like that's
anon.
willing to donate her
So
eggs. Yes.
yeah, at that time, see, I was also going to ask because I think she mentioned somewhere in it that she said, we opted for an anonymous donor, which was a very difficult decision to
Okay.
swallow, especially for her. Next, the donor's eggs were collected, and also she was talking about the next step. And also,
Okay.
I was also going to ask, do people, because sometimes I think another thing that worries people is they're like, okay, how do I manage that? I know that this person, what if this person comes tomorrow and say it's my child, you are carrying
Okay.
using my eggs, so how do you people manage
Yeah, so like you
all
said,
this?
the kind of egg donation we do is an anonymous process.
Mm.
So we are the intermediary.
Okay.
Yes, so the clients do not know the donors,
Okay.
and the donors do not know the clients
Oh
they are
wow.
donating for.
Oh, so
Yes,
that makes it
yes. So that
easy.
makes it easy.
Oh
That's
wow. But there are
yes.
times you have people that bring their personal
Yes, we've
donors.
had occasions where people bring their personal donor,
Oh
and they're
wow.
welcome to do that if they
Hmm.
choose to. Yes,
Okay.
yeah, we've
Oh, I
had
see.
people that brought their sister, brought a
Hmm.
relation. Yes, people.
Wow.
Yes,
Wow.
what we just do is evaluate and make sure they are the
Yeah,
best
fit.
fit to
Mm.
donate. Yes.
Wow. Okay, so for someone watching, it could be both ways, but whichever way you know that the hospital Alps hospital got you covered, in whichever way you decide
To
to
go.
go. And so she obviously opted, and for the first time,
She
she got to a
succeeded.
day 5, and the embryo was good. And according to her, she said the embryo got to the blastocyst
Oh,
stage.
that's a good
Wow.
grade.
So
Good.
when you say blastocyst stage,
Yeah,
I
so there's a
mean,
way we grade embryos. So
okay.
blastocyst is like at day 5, like the highest grade you could
Oh
have.
wow,
Yes.
wow. So that was more like a first time for her, knowing that
Yeah.
she has always had to deal with growth
Arrest
arrests.
at day 3.
Yeah, okay.
Yes.
So and then got so good to her, it resulted to pregnancy. And so she said, thankfully, the embryo successfully implanted after an embryo transfer, and the out of all the embryos, one succeeded. She said they were beyond thrilled to become parents. I
I
can
can
imagine.
imagine after
Yeah, I can
waiting
imagine.
for
And she
that
said,
long.
becoming
After
first
this,
time parents has been a beautiful and humbling experience, of which we are most grateful to God and to the entire Alps team. Yeah, a round of applause for Alps team. Oh, yeah. So she's grateful to God. Of course, God is over all this. And then,
yeah,
yeah, you
yeah.
also have good expertise at the Alps hospital to do the right thing, because it's one thing to have God, and then it's one another thing to do
This
things
to do
right, the
right
way,
thing.
have
Yes.
it done in the right way to achieve results with
Yeah.
good expertise. And so she said, every smile and giggle from our son, oh, it's a boy, is a reminder of how far we have come, and embracing every precious moment with our son. This is so touching. We're so happy for you, ma. Congratulations once
Yeah.
again on your son,
Congratulations
because
again.
she did send the she sent this message. I think she sent it this year January. So obviously
Okay.
she was able to get all this happening maybe around somewhere in 2024.
For
So
yeah.
after waiting from 2019 to that was, I mean, for her that's like
And the
five
wait is
years.
more than
Yeah,
2019. All the
exactly.
years
Oh
going through
yeah,
all
that
the
she had
various,
struggled. Oh
you know,
goodness,
I can
I can
imagine.
imagine.
Yeah.
Yeah, I really can imagine. It's
This
really
is
an
really
emotional
heartwarming.
one. And
Yes.
then she's also encouraging others that you should take the counsel that is given to you by
Yeah.
your physician. Keep your mind
Open.
open,
Very
and
important.
there's always hope. Like she said, there's always hope once you don't give up
Yeah.
and you keep an open mind. You will definitely get your dreams achieved of being a parent. Oh wow. So please, for someone watching, you can actually hear what this woman has to say to you. This is coming from someone that had tried all options and she was not achieving success, but she kept it open.
Yeah,
And
she
then
didn't
I
give
was,
up.
there was
And then
something.
being open-minded, being open to counsel, very
Mm,
important. A lot of our clients, a lot of people are fixed in their ways, fixed in their
have
beliefs,
their own
their way of
opinions
reasoning.
encrafted in them, and
When you try to suggest something different, they They don't even take the time to
Strong-willed.
listen. Yes, they just want to. But if you keep doing the same thing the same way, you don't, and you don't expect the result to be
To
different.
change.
Sometimes you might need to really be open to doing something different
Different.
for us to achieve the results we all desire. Yes.
So for speaking of donor eggs, because sometimes women also battle with the fact that okay, now I can't use my egg. What if this child does not look like
Like me,
me? Does
yeah,
not
a
look like my
lot. That's a very
husband?
valid concern
Yeah.
they
So
have. Yes.
it gets us wondering: are there things that this baby could or babies could get from the woman carrying the
The
pregnancy, last
pregnancy.
their mom carrying the
The pregnancy.
pregnancy?
Yes,
Yeah.
definitely. Yes. The
Wow.
baby gets things from the donor.
Okay.
Yes, from the husband's sperm, the donor
Okay.
contributing the egg, the
Yeah.
husband's sperm, and even the woman carrying the baby while in
Wow.
utero in the womb. There's
Okay,
still
so
some
there's some
genetic
extra. Oh,
exchange, yes,
wow.
between the mother and the baby. You'll
Hmm.
be astonished. We've done a lot of donor egg treatments. If
Yeah.
you see how these children, especially those that are female, resemble their mothers, you'll be
Wow.
astonished. I'm
Oh my
telling you.
goodness.
You know,
Wow,
so there's
that's
a
so
way the
nice.
genes, a baby is not just the
Hmm.
genetics, also the nurturing. The way
Hmm.
somebody resembles somebody is not just physically, even the way
Hmm.
you behave. A child
Yeah.
behaving like someone could be a way the
Hmm.
child resembles you. And then,
Yeah.
in genetics, they're what we call recessive dominant genes.
Okay.
Yeah,
Wow.
so
Wow.
sometimes you can't really determine what the child will pick from who.
From.
Yes, we've seen female children that look so much like their
Yeah.
fathers that the mother wonder, what happened, this child didn't pick anything from me.
Exactly.
Yes, so there's a lot of things that interplay in what
Wow.
the baby will eventually look like. But
So
we've always had good outcomes. In fact,
wow, that's
they're
so
not
lovely.
children you go out with and people will be wondering who
Would
is the mother
exactly.
of
So
these
you can always
babies.
count on the house team to
Yes.
match you well.
Yeah,
Once you
that's
have your
one thing we do.
specifications, they'll
Yes.
try to match you to someone that
Yes.
looks like you, and then your child will not just look like the child just came out of the blues.
Yeah,
I'm
exactly.
wondering where this baby came from. But come to think of it, there are times that you have both genetic father and mother, and then the child doesn't even
Even
look
look
like
like
any
any of
of
them.
them.
Maybe
So
look like a
oh my
grandparent or look
goodness.
like an, yeah, we've seen
So
that
why
a
do you
lot.
have to even kill yourself over
Yes,
that?
over that. Exactly.
you know
Yes.
so dear viewers, it's good that you keep it open. Yeah, I mean, some of you are open to adopting children and you
Exactly.
don't even have any bond with those adopted children. How
Mm.
much more having to, I mean, embrace the having to nurture the baby in the
That you
uterus
carried.
for about 9 months,
Mm.
and then this baby gets to be nurtured by you when the baby is delivered.
Right.
I mean, sometimes you might breastfeed and just the nurturing process, and there's a lot
Yes.
of bond. So it's really a technology that I think people should welcome and
Embrace
embrace.
more,
Yes,
especially
embrace.
yes,
It's
yes.
a dream for you to achieve parenting, and it's a higher form of achieving parenting than even adopting if you have
Adoption.
the means. So please, dear viewers, if you know someone struggling with fertility, even if they're already in their menopausal state, they
Stage,
could
yes.
still use donor eggs and still have the ability to achieve their dreams of becoming parents.
Parents,
This
yeah.
is coming from someone that had struggled. I mean, this person speaking from this, she's actually a young person, but she has struggled with
Mm.
her ex, and pregnancy was still
It's
not
not
forthcoming,
happening.
and she kept it open. So why not you that is also struggling? Please keep it open. Have an open mind to take counsel from your fertility specialist, a good one at that, like the house hospital. There's actually no they are second to none in house hospital.
Yeah,
So
we're second,
oh yeah. So
seconded.
for our viewers, please, there's just a lot to this.
Yeah.
Let's take some questions while we proceed. Someone is asking Dr. Deborah, how long? Okay, this is Shadrach asking, how long does IVF treatment take?
So IVF treatment itself depends. The time duration depends on the kind of IVF we're doing for you, but
Okay,
averagely between 4 to 6 weeks.
okay.
IVF treatment takes between 4 to 6
6
weeks.
weeks. Oh wow.
Yes.
Okay. Okay. Wow. So hope this answers your question. Dear Shadrach, IVF
And
takes
they
about.
should note that they don't have to be domiciled here for the whole duration, like we
Hmm.
explained. Some part of the treatment will be done where they are. They might just need
Okay.
to come in for a few days during that time
Okay.
duration.
So are
Yes.
there some other forms of IVF that could be shorter than the 4 to 6 weeks?
Yes. It could be
Oh,
as short
okay.
as 2 weeks
Oh
at about,
wow.
yes,
Okay, so
depending on
so
the
it
kind
depends on the form of
form of
treatment
treatment
that
we're
you're
doing.
assessing. That's for
Yes.
Shadrach asking. Okay, well, so Calvin is asking, what's the chance of success of IVF for a woman who is above 40?
very high chance of success, but you
Okay.
have to be open to the options we talked about and counseling. Definitely the woman we assessed. Looking at a woman that is 40, we're looking at a high chance of counseling her for use donor eggs. So they
Okay.
need to be open to that. Yes, yes.
So this is for this person that asked this question. So the chance of succeeding is higher if you take the
Do,
right counsel. But if you go by
yes,
your way, we can also not guarantee that your success rate will be high. But then we're not God.
you can give it a
Yes,
chance.
so
Yes.
we cannot rule out your chance of succeeding. Okay. So dear viewers, keep your questions coming up. Keep your questions coming up as we. Okay, so speaking of donor eggs, are there times that um people could still have children that could come down with congenital issues even with donor
IVF.
egg? Yes, even with
Yes,
IVF
definitely.
and donor eggs. Yes,
Yes,
maybe. Okay,
yes.
so there are chances.
Yes, there are
Well, maybe
chances, though
tell
they
us
will
a
be
little
slim
more.
because the donors are usually very young ladies.
Mm,
So the fact that congenital anomalies are happen doesn't mean it's from the eggs. It could be
mm,
from the sperm, the
mm.
partner's sperm. It could be an environmental thing. Maybe
Issue.
the woman took some drugs she wasn't supposed to take, some drugs
Mm,
that are contraindicated in pregnancy. So that's why
okay.
we cancel pregnant women should not take drugs without medical advice. Yes.
Advice.
So the fact
Wow.
that it was donor eggs that was used and a congenital anomaly resulted, it doesn't mean it's from the egg. It could be
Okay.
due to
Oh.
other things, yes, but
Hmm.
congenital anomalies could arise.
Oh wow. Okay. So what I okay, you just mentioned environmental factors as
Yes.
to one of the reasons that congenital
Taking
issues
drugs
could.
you shouldn't take. There's some drugs that are teratogenic that
Hmm.
could cause abnormalities in a developing, embryo or fetus.
Okay.
That's why some drugs are contraindicated in pregnancy. So if you take those drugs without medical advice, you could cause issues for the baby growing in the womb.
Okay. So of course, so this is me asking because um, now we're counseling. I'm just imagining that maybe this woman tried donor eggs and the IVF didn't succeed. So are there chances that people could actually opt for donor
Donor
eggs? Maybe that
eggs
was your counsel to them, and the IVF could still fail.
fail, definitely.
Oh wow,
There are no
really?
100% guarantees with IVF.
Hmm.
Even the best of centers,
Wow.
success rate is not 100%. So even
Hmm.
with donor eggs, if a woman is cancelled for donor eggs,
Hmm.
so that means from the evaluation and everything that has been done, we've seen that donor eggs offer her a higher chance of success, but this higher chance is not 100%.
Hmm.
Yes, so IVF could still fail with donor egg treatment.
Hmm.
Yes, and the failure could be due to other factors. It could come from the sperm, it could come from the endometrium, it could
Hmm.
come from some hormonal abnormalities in the woman if they're not
Hmm.
well taken care of. So from a
Hmm.
lot of issues. So failure on IVF could come from different areas. Yes,
Angles.
so it might not be because of the donor egg. It might be
Hmm.
the womb that the embryo was placed into. Maybe
Hmm.
this woman has intrauterine adhesions. Maybe she
Yeah.
has polyps. Maybe she has huge fibroids
Yeah.
that she doesn't want to be operated. She
Hmm.
could have background adenomyosis. These are all unfavorable environments for
Wow.
implantation and pregnancy to occur. Maybe she
Hmm.
has uncontrolled hypertension.
Okay.
Yes,
Hmm.
or she had
Wow.
thyroid
A lot of
gland
factors.
abnormalities. So a lot of factors could be responsible for failure. That's why we try to do a thorough evaluation, and make sure that the best environment. But sometimes there might be some damage that you
Hmm.
cannot totally correct. You can't totally correct. A woman that has severe intrauterine adhesions, yes, you might do hysteroscopy, do
Hmm.
adhesiolysis to try to ameliorate this, but that lining will never go back to 100%,
Percent.
the
Wow.
way it was. Yes,
Hmm.
but that's the best she has, and she takes a chance with it. Yes.
Okay.
So the fact that it was donor egg, the failure is not because of the donor egg. The failure
Hmm.
is because of that lining.
Oh,
Yes.
so dear viewers, the fact that your fertility specialist recommends using donor egg treatment is not, they are not trying to tell you that it's 100% guarantee.
Yes. Yeah.
It could fail. They are just trying to increase your chance
Of
because, like Dr.
success.
Deborah told us
Yes.
now, that IVF is not 100% guaranteed anywhere. So anything to just do to increase your
The
chance,
chance of
that is what they are
success.
preferring to you. But it still could fail. So you could give an allowance for failure while you hope for the best. And we really do hope that even if you assess the care, you're able to succeed at your attempt at it. So we'll take this one last comment before we would wrap up for today. So this person said, "Oh, this is so sad. So she did an IVF somewhere in Port Harcourt, and her tests was negative just
Mm.
yesterday. So sorry about
Oh,
that,
so
Somi.
sorry,
So
madam.
sorry.
Can
It's
imagine
really, yeah.
the weeks of anticipation
Yeah, I
and
can
then the
imagine the
almighty
longest
pregnancy
wait. Oh my
test
goodness.
negative.
So me, so
Mm.
sorry. So she said, but she refused to allow it to weigh her down.
Mm.
And this
That's
is
the
actually
spirit.
her second attempt. Oh wow.
Oh, oh.
So she's wishing that she has money to try again at Alps Hospital. And she's pleading with Alps. So this is Alps Powerhouse. I'll tell her. That you people should have a branch in Port Harcourt. Oh yes, so Abuja, we are coming for you. So Port Harcourt,
Yeah. Don't
maybe
worry, very
they
soon
would
too.
consider that. So I've
Yes.
related it to the powerhouse. I'm sure they'll think about it. But for Abuja, we are
We're
coming
coming
for
on
you,
board for
right?
Abuja.
Like full force, full force. Some people are so sorry. And we really do hope that you are able to get the funds to assess treatment. Don't give up, try
Yeah.
again, and we know that you will definitely succeed. We hope that you are able to get funds to assess treatment again and get the best outcome out of it. Thank you once again, dear viewers, for staying tuned to us today. Thank you, Dr. Deborah. It
Thank
was
you, Ruth.
really good to have you with us
Thank you
today.
for having
We
me.
had a very nice time with you, dear viewers. Once again, on behalf of Alps Hospitals, we love to say thank you for engaging with your comments, with your questions. Please continue to stay tuned. Continue to like our post, continue to share. If you have your questions, you could send your questions through our private chat on the number being displayed on the screen, or you could send it on a DM message, either Facebook, Instagram, whichever of our handles. We'll definitely attend to them appropriately. Thank you once again, and have a good evening and a lovely weekend. Bye.